Bom dia a todos, sejam todos muito bem-vindos ao mini fórum da Sociedade Brasileira de Cirurgia do Ombro e Cotovelo. Inicialmente, agradecemos o patrocínio da Bering, quem nos possibilitou a utilização dessa plataforma. Como que é de conhecimento de todos, nós deveríamos realizar essa assembleia extraordinária durante o Congresso Brasileiro de Cirurgia do Ombro e Cotovelo, que infelizmente tivemos que cancelar devido a essa pandemia. Portanto, estamos realizando essa sessão de forma mista, parte presencial e parte virtual, juntamente com o Eduardo Malavolta, que é o nosso segundo secretário da SBCOC, e o Joel Murachovs, membro da SEC-SBOT, como um piloto de próximos eventos da sociedade. Dividimos esse fórum em duas partes. A primeira parte aberta, com os palestrantes, com palestras bastante interessantes, o Dr. Joseph Zuckerman, a doutora Mariane Pedroni e o Dr. José Ricardo Pécora. E a segunda parte limitada somente aos associados kits da sociedade. Após esse módulo, a sessão será encerrada e todos os associados kits deverão fazer um novo acesso, no mesmo endereço do acesso inicial, para participarem da Assembleia. Para sua comodidade, você poderá acessar essa transmissão por meio de sua Smart TV, pelo endereço eletrônico sbcoc.com.produtora.com.br. Okay. All of us take the day-to-day activities for granted. After the corona outbreak, we realized that we miss a lot of single things like just shaking hands or giving a hug. But we have learned to make lemonade from lemons that were given to us. We fortunately have the personalities who can share their time and their knowledge with us, even on Saturday morning, to teach us their experience. I'd like to introduce you Dr. Joseph Zuckerman from NYU Langone Health, New York, to talk about 50 Commandments of Leadership. It will be an awesome talk for not only all the heads of shoulder and elbow service from Brazil, but for all people of their lives in general. Thank you very much, Dr. Zuckerman, and it's a great pleasure to have you with us. So please, let's get started.
Thank you very much, Roberto. First of all, I'm very pleased to be able to join you today, even remotely, when I've known Dr. Nakamoto for a long period of time, and when he asked me to do something educational like this, I will do everything I can to make it happen. We've enjoyed a very productive and educational relationship, which I value. So I'm happy to be here with you today. I feel bad about your situation in Brazil. It's much like our situation in the United States, but there will be a light at the end of the tunnel. Hopefully the tunnel is not that long. So it's a pleasure to be with you. So I particularly enjoy giving this talk, which is, as you can see, is the 15 Commandments of Leadership. The reason it's not the 10 Commandments of Leadership is because no matter what I tried, I couldn't fit it into 10, so I had to call it the 15 Commandments. We talk about a lot of different things in orthopedics, and I've given talks on multiple different topics, including, shoulder, and hip, and knee, and such. But this is one. These talks like this is what I really value. So, but let me give you a little background. So first of all, I've never had any formal training in leadership. I've always had only on-the-job training. The important thing is that I paid attention, I guess, to what I was doing and learned from my errors. All right, because in a certain sense, we really have to understand, right, what we're doing and the impact on others. So this is a little bit of a background of myself. I graduated from the Medical College of Wisconsin in 1978. I finished my residency in Seattle at the University of Washington in 83. I did an adult reconstructive fellowship and shoulder fellowship in 84. And I joined the Hospital for Joint Diseases in 1984. as a member of the faculty. In 1990, I was promoted to vice chair and director of the orthopedic residency program. And in 1994, I became the chair at the Hospital for Joint Diseases. 3 years later, we merged with NYU Langone Medical Center, and I became the chair of the department there with the responsibility to combine two different departments of orthopedic surgery into one. And during that initial 10 years, I served as director of the combined residency program. So today, if you look at NYU Langone Orthopedics, it's a large department. I have 5 vice chairs, one focused on clinical care, one on education, all educational programs, one of our clinical practice, in other words, our faculty practice, one for research, and one who is responsible for our peer-reviewed journal that is published 4 times each year. We have 10 clinical divisions, each with a chief, as you would expect: adult reconstruction, pediatric orthopedics, oncology, hand and wrist, shoulder and elbow, et cetera. We provide care at 5 different clinical sites within the New York City area, not only in Manhattan, but in Brooklyn as well, and in Queens, New York, which is the surrounding boroughs. We have 155 active orthopedic surgeons on our faculty, 110 of which are employed as full-time physicians in our faculty practice. We have a large residency program with 72 residents a year in a 5-year program and 21 clinical fellows that come each year. Now, what I'm going to describe to you really is leadership in terms of what does it mean to be a chair, because that's my experience. And I'm going to give you the perspective that has been given to me from our dean. I'm going to give you my perspective, and then I'm going to give you the perspective of another Dr. Zuckerman. And no, this slide is not a typographical error, as you'll soon see in the presentation. A number of years ago, our dean and CEO sent an email to all the chairs with his expectations of what it was to be a chair. And he said some things that have stayed with me since the whole time and has been provided me with some guidance in how I can best perform my job. So he said that the role of being a chair carries a rightful sense of achievement. I'm supposed to feel good about it. It's a prestigious position. I get that. However, it's not a destination. It's a vehicle. It's an opportunity to do other things. So it's not the end point. It's a beginning point. He also said that the investment that was necessary was going to divert time and energy from other professional and personal pursuits. And you have to get used to the fact that the achievement, as you define achievement, really is defined as bringing out the best in others, not your own personal achievements, that you gain and you benefit from the achievements of those around you that you've helped them to accomplish. And being a chair requires a true authenticity. You have to genuinely care about the well-being of those who report to you. If you can do that, then you will have their allegiance and support. Very important aspects. And these have been some guiding principles for me. One thing I found is that, particularly in a large department, leadership requires delegation. Everybody says that. Everybody says you have to delegate. You don't have time to do things, but it's something that's easy to say, but difficult to do. Letting go of things, particularly if you have a history of being a micromanager, is a transition that can take some effort. However, it's truly one of the keys to success. So when I look at delegation in this context here, right, it's important to consider the 4 R's. In other words, who you delegate responsibilities to has to be the right person in the right situation. That person has to have the right skill set, and there has to be the right reporting mechanism. In other words, the people who are your lieutenants, the people who you work closely with, have to recognize the importance of reporting back to you, providing you with information, so you're not in a situation where you don't know what's going on, even though you may not be primarily responsible for it. And I'm very fortunate in my department to have key individuals in these positions who can fulfill these responsibilities. But it wasn't always that way. I've replaced some people in important positions because they didn't fulfill these requirements that I thought were very necessary. So let's get to the 15 commandments. This is according to me. So first of all, number 1 is it's really more about responsibility than authority or power. The reality is that once you get to be a chair, you have tremendous responsibility. However, you can't tell people exactly what to do and expect them to do it. The power you have is the ability to fulfill responsibilities. You can't accomplish anything without the support of those around you. So you've gained a lot of responsibility and people think you're in charge, but being in charge doesn't necessarily mean you can just do what you want. You have to really recognize that. And to accomplish that, number two is you have to build consensus. That's the key. You have to develop support, right, of those around you. But consensus doesn't mean unanimity of opinion. Sometimes you just have to take the temperature of how people feel and decide to move forward, recognizing that 70% of the people may agree, 30% of the people may not agree. However, what's critically important is for the 30% of people that don't agree to have their opinions heard and listened to. That will make it easier to go forward. Number three is communicate, communicate, communicate. I don't think you can communicate too much. Frequently, I'll send out emails to the department reviewing certain situations that occur, both things we need to do and things we've done well. People value communication. Nobody wants to be kept in the dark. You have to recognize the fact that you may have all this information that you think other people have, but most of the times they don't. So communicating is very important. Number four, as a leader of the team, you're also a member of the team. So yes, you may be captain of the team, but you also have to interact with everybody else. And that prevents you from thinking too much of yourself and getting too self-absorbed in your own position. Number five, each action or decision will generate a response. And it's our responsibility to try and anticipate the reaction and never underestimate the reaction. This is what I call the $5 rule. You know, I frequently say the most important $5 that anybody has is the $5 that I want to take away from them. The $5 isn't important, but the fact that I want to take it away from them is important if they don't understand why. Now, conversely, the most important $5 that somebody could receive is the $5 that I give them that they don't expect. In other words, doing things for people that they wouldn't expect, something positive, no matter how small it is, can have a great benefit in your role as a leader. Number six is take what you do seriously, but don't take yourself too seriously. You have to maintain a certain humility about who you are and what you do. You put your pants on the same way every morning, you brush your teeth the same way everybody else does. You have more responsibilities, but in reality, you're not much different than everybody else. So I think that helps you maintain the humility, which increases and enhances your ability to interact with those around you. The number seven, you're going to go to a lot of meetings, and that's for sure. And when you go to meetings, right, it's important to accomplish something. Now, sometimes the worst thing you can do is sit around for an hour at a meeting and not accomplish anything. So I always think it's important at the end of the meeting, you summarize what was decided, what needs to be done, and most importantly, who is responsible for each action item at the end of the meeting, because that will hold people responsible for it. And also you include yourself in the list of things to do, because that's how you get to number 8, right? You take responsibility to get things done, but you don't take all the responsibility. You have to rely on those around you. And that's where that important characteristics of delegation is allows you to accomplish things. Number 9, I call this the first to arrive and the last to leave is an essential component of leadership. I think that the time and effort you put into your position defines your work ethic, and the work ethic within an organization is important. It would be hard for a leader to criticize the work ethic of others when they themselves are not providing that same level of work ethic. So I think that's important. And I've extended that to even when I recruit people. Yes, we look for people to join our faculty who are talented, good surgeons, have ethics and integrity, but I also look for that work ethic because I think that will allow people to be successful. Number 10, no one has ever been considered a bad leader because they listen too much. A lot of leaders talk a lot, but they don't listen as much. And I've had to learn myself how to listen much better to what people have to say and not react. And that's been a learning process that's taken place over a number of years. So, you know the expression, nobody ever listened themselves out of a job, right? People have talked themselves out of a job, but not listened themselves out of a job. Hold on, I gotta switch the slides here. Number 11, right, is that information is essential for good leadership. The more information you have, the more meaningful your activities become. It's important to allow people to provide you with information, but you have to seek information, right? Because oftentimes, if you don't know something and if something is brought up, you will look as if you're not really the leader that you should be. Number 12 is it's important to be, you can be yourself, right, with some modifications. Your behavior is always being observed, particularly these days when people will record things, will video things. You have to avoid the extremes of behavior. Things that you think you may not, you don't necessarily say. I mean, every day you hear things in the news where people said something that when they thought they weren't being listened to or observed, right, they've come back to haunt them. There was something in the news here yesterday. Somebody, a sports announcer for 25 years, made a homophobic response that he didn't think anybody was listening to. Well, they were listening to it, and after 25 years, now he's out of a job, right? You can't do things, right, without thinking about it. And also similar to this is your behavior sets the standard for others. If as an orthopedic surgeon, if your behavior in the operating room and how you treat people, right, is not where it should be, then that people will perceive that they have permission to do the same. So you can't do that. Number 13, and one of the greatest motivating factors, I think, is when people feel respected, when you're responsive to their suggestions, when they ask for help and you provide it to them, and you tell them when they've done a good job. Most of the time, we don't recognize people for what they've accomplished. So saying to somebody that they had a paper published, or they were chosen for an award, all those things like that are important. They make people feel good, and that's where you help. That's where being chair is not a destination, all right? It's a vehicle to do all these things for others. Number 14 is that, rumors are always inevitable. You hear things that are true or not true, right? The best thing you can do, I found, is when I hear something that's a concern to me, I try and go to the source so I can dispel any rumors swiftly. I've heard people say that sometimes the chairs will start a rumor to get things stirred up. I never understood that, right? That makes no sense to me. I mean, truth and honesty is most important, right? And so don't let rumors get in the way. Try and prevent them from going anywhere by clarifying any misunderstandings. Number 15 is, I have, even within my vice chairs, I have 2 or 3 people that I'm very close with that I discuss things in great detail, people that I can trust, my confidants, right? But I also recognize that there are some things that you just can't share everything, right? Because whatever I say to somebody else could ultimately be shared. So you have to have a certain sensitivity about that. But you do need people that you can trust and you can bounce ideas off of. So, and if you have that, that will help you become a better leader, because it allows you to test the waters to a certain extent. You don't know everything. You need other people to help you. So those are my 15 commandments according to my own experience. Now, let me tell you about the other 15 commandments of leadership, right, according to the other Dr. Zuckerman, and that's the Dr. Zuckerman that I live with. My wife, Janet, is a clinical psychologist and psychoanalyst. So we've been married for 36 years. And during this time, she's taught me a lot that I have applied to my job as a department chair. I've also applied it to my marriage and my relationships with my wife and my children. So that's a great added benefit to this. So this is what she's taught me. The first is, don't underestimate the impact of what you say and how you say it, or how you say something is not necessarily how it's heard. Now that relates to the second one about intention versus impact. You may have the best intention in the world in saying something. However, the impact on that person may be underestimated. I've said things at times which I thought were harmless, were neutral, but they had a very negative impact on the person that was hearing them. The more you can recognize that and appreciate that, the better your relationships will be with the people in your department. The next one is a little hard for orthopedic surgeons because we're a little hard driving. It's better to get along than be right. We go to conferences and we discuss cases, and somebody has a point of view. This one requires a hip replacement. No, you should fix the fracture. And we can feel very strongly about that. However, you don't want to take these discussions to the point where you have to prove yourself right. Accept the fact that you can make the point, people can disagree, right? And you can respect each other's opinions. You don't want to sacrifice relationships just so you can feel that you were right and the other person wasn't. So the next one gets back to the listening, all right? It's important to listen and listen well, because this is critical for all interpersonal relationships. Most of us are not good listeners. However, it's a skill that you can learn, because you'd be surprised how much you can gain from listening to others, asking them about themselves, and understanding it. It enhances and strengthens your interpersonal relationships. Next one is understanding and validating one's feelings and viewpoint is important, but it's not the same as agreeing. When I have a faculty member come to me and say, I feel this way about something, and I don't agree with him or her. I just feel completely differently. However, I don't tell them they're wrong. I tell them that, well, I understand how you could feel this way. I understand how you concluded this, but another way to look at this is such and such. So understanding what people bring to the table is important, right? But I don't have to agree with everybody, but I do have to listen to them and try and understand their perspective. So these are the things that I have added to my role and my understanding of what is the commandments of leadership in my own position. Now, what's interesting is that I've been doing this for 23 years now at NYU, and I still consider it a work in progress. A week doesn't go by that I don't learn something else that I think allows me to integrate a behavior change into my daily activities. This is very important because a leader as a destination, as I said, we really have to self-evaluate and understand all the different aspects of what we do and continually change our approach if we're really going to be successful as leaders in orthopedic surgery, in medicine, or in life in general. So with that, I'll stop, and I will thank you very much.
Thank you, Joe. Se alguém quiser fazer uma pergunta, vocês podem fazer pelo chat, qualquer pergunta. I think it's the action is more important just to talk or speak something for your staff. But it's difficult to manage with the human, different personality or feeling or behavior. I think orthopedics is like a military, different from other specialties. How do you manage with the hierarchy, and how do you think it is important?
So you're right. One of the reasons that we're successful in medicine is because it is a hierarchy. We go through a process where you're medical students, you're a junior resident, you're a senior resident, there are attendings, there are division chiefs and such. And it's that hierarchy that makes it successful. And that you have to have that hierarchy, frankly, to be successful in patient care. However, the hierarchy can't be to the exclusion of accomplishing what you want to do. So, and we maintain a hierarchy, but it's a loose hierarchy, right? Nobody, it's not like the old European systems in which nobody could talk to the chief. You had to do this, you had to follow certain protocols. Ours is more, for lack of a better word, more ecumenical, right? And I think that's important. Now, as a department chair, there's a hierarchy above me, right, that I have to manage. So the important thing is, I think, is a successful leader manages the hierarchy above. You manage up very well, right, to the people you report to, but you have to manage down very well to the people who report to you. So maintain a loose hierarchy for structure and making sure that the systems run, but not to the detriment of relationships. I lost your sound.
Okay.
Okay.
Oh, thanks again. It
Okay.
was an incredible opportunity to listen to your talk and for everybody to be able to improve the leadership of their service and lives. I hope to meet you soon in person at the next time, and be safe and healthy. Thank you.
We will see each other sometime. Thank you, and thank you for inviting me, and good luck with the rest of your course.
Thank you. Bye.
Bye.